Okay, can we okay, we're good.
Hello and welcome. We're excited to kick off our SAC orientation for school year 21-22. This afternoon, we are grateful to hear from Dr. Benjamin Schwartz, the Director of the Division of Epidemiology and Population Health with the Fairfax County Health Department. This afternoon, our current SAC Health and Safety Planning document, HSP, will be sent out, and tomorrow afternoon, there will be cluster meetings to review the current updates. I specifically say current updates because we're committed to incorporating the best guidance to ensure we have strong implementation in place to prevent the spread of COVID-19. The SAC HSP that you will receive is our 7th update since June of 2020. One of the very important components of our health and safety planning is our ongoing communication and the support from the Fairfax County Health Department. I am grateful and delighted to welcome Dr. Ben and so appreciate the Health Department and Dr. Ben's leadership, support, and tireless efforts to keep our community informed, safe, and healthy. After the presentation, there will be an opportunity for questions and answers, so please email Rhonda Ross. And at this time, I'm really pleased and honored to welcome Dr. Ben.
Great, thank you so much, Anne. It's a pleasure to be with you and with your team. And I want to begin by saying how much I appreciate everything that you do, everything that SAC does for the children in our county. You certainly provide an important service during a very difficult time. So let me begin sharing my screen and we'll go through this. Okay, and hopefully you're all seeing the right presentation now. So I'm going to provide a quick update on COVID disease in our community, and then talk a lot about prevention and how we can keep our kids safe in the school setting. So it's been a difficult 18 months for us, with a lot of ups and downs, with recommendations that have frequently changed. And these changes have occurred as we've learned more about the virus, as we've learned more about our control measures, and most importantly, as disease levels in our communities have changed. So what you see on this figure is the last 6 months of the pandemic, starting on the left-hand side of this figure in mid-February. And what you can see is that in February, we were on the downside of that large wave of disease that we had last fall and winter. And it came down toward the beginning of March and then remained stable for a month or two, and then began to decline once more as we reached the summer. And so 2 things were happening at that time. One is that people were beginning to spend more time outside, and that certainly pushed the numbers down. But most importantly, we had an increased proportion of our population that had received the COVID-19 vaccine. So that by the time we were in mid-June, there were days in Fairfax County where in the entire county, we had fewer than 10 cases. But unfortunately, it did not stay that way. And as we moved into July, cases began to increase once again. Now, what we're seeing here with this increase certainly is not what you hear about taking place in Florida, in Louisiana, in Arkansas, and a number of the other states around the country, where hospitals are overwhelmed. Unfortunately, we've had very few hospitalizations in Fairfax County, and we still have an average of less than 1 death per day. So we're not seeing a lot of the severe disease that has been seen elsewhere, but as you can see, cases have certainly increased. The recent increase is attributed to the spread of the Delta variant. And what's shown here in these colored bars is data from CDC, and these are national data, with the Delta variant being shown in the darker orange colors. And what you can see is that the Delta variant began to spread nationwide early in June and has very rapidly become the predominant strain causing disease. With at the end of July, 92% of all infections, CDC estimates, are caused by the Delta variant. The reason why Delta could take over so quickly is that it's more transmissible than other variants. You may have heard something about a CDC memo saying that it's as contagious as chickenpox. And while that's an exaggeration, it is not as contagious as chickenpox. It does spread at least twice as rapidly as the original COVID-19 strain that we were experiencing a year and a half ago. Shown here are the levels of community transmission as they've been defined by CDC. And this is important because at various levels of transmission, there may be recommendations for different types of mitigation activities. So CDC has defined 4 levels of transmission: low, moderate, substantial, and high. These definitions are based on 2 criteria. First, the number of cases per 100,000 people seen in the last 7 days. And secondly, the proportion of PCR tests that are positive during the previous 7 days. Whichever one of these 2 metrics is higher defines the level of community transmission. And so, for example, CDC recommends that at levels of transmission that are substantial or high, even people who are vaccinated should be masking indoors in public places. And indeed, that's where we are right now. So applying this definition to Fairfax County, we currently are at substantial transmission. And that is, again, largely based on the rate of disease in our community. The path out of the pandemic is through people developing immunity against coronavirus. And there are 2 ways to become immune. One is from getting disease, or the other is through vaccination. And of these, vaccination for sure is the better option, because getting disease carries the risk of serious infection, death, or what is being called long COVID, where some symptoms may persist for months. And this may be experienced by as many as 1/3 of people who develop COVID infections. Vaccination also may provide better immunity than natural infection and broader immunity, that is, covering more different variants. And so people, even who have gotten natural disease, are recommended to get vaccinated as well. Shown here are some vaccination numbers for Fairfax County. Overall, more than 772,000 people have received vaccination, which is about 2/3 of our entire population in the county, over 77% of adults. And I'm really pleased to report that we are doing extremely well vaccinating adolescents, with 77.1% of adolescents having received at least 1 dose. Now, the number of adolescents, or the proportion who are fully vaccinated, is a little bit lower because many of these adolescents have been vaccinated recently and have not reached that 3-week interval when they are now eligible to receive their 2nd dose. In addition, I want to point out that just last week, the FDA and CDC approved a third dose of the mRNA vaccine for people who have weakened immune systems, either due to illness or medication, so that anybody who does have suppressed immunity and who has gone at least 28 days since their second dose is eligible to receive that third dose and can do so at health department sites and also at many sites around the community. While we emphasize our success in achieving vaccination of more than 3/4 of those eligible to be vaccinated, we also need to note that there are over 400,000 people in the county who are not yet vaccinated, about half of them those who are eligible, and the other half children who are too young to be vaccinated. So that is a lot of people who can fuel the continued spread of COVID-19, but also many people who hopefully will make a decision that vaccination is the best choice. With Delta emerging as the predominant variant around the county and in our country, an important question is whether vaccine works for this variant. And the simple answer is yes, it does. Studies that have been done in multiple countries show that vaccination is still highly effective, particularly in preventing serious infection that may lead to hospitalization or death. Breakthrough cases, that is, infection occurring in someone who's fully vaccinated, do occur, as no vaccine is perfectly protective. But the data from several studies show comparable effectiveness against severe disease for Delta as well as for other variants, and slightly lower, but still high effectiveness against all COVID infections. Thus, what we're seeing here in Fairfax, similar to the rest of the country, is that the pandemic is largely a pandemic of the unvaccinated. Therefore, we strongly encourage everyone who has not been vaccinated to make that choice and get the vaccine. While young children, those under 12 years of age, are not yet eligible for vaccine, it is likely that FDA will approve vaccine for 5 to 12-year-olds, perhaps in October. But until then, young children can be protected if those around them, their parents, other eligible family members, and caregivers are vaccinated, as well as if people broadly in our community receive vaccination and lower community transmission. We all know that vaccines are widely available and free, and there are over 200 sites in Fairfax where vaccinations are given, many of them accepting walk-ins, and these sites include pharmacies, grocery stores, healthcare provider offices, as well as our clinics. And certainly more information about vaccine can be found on our website. While vaccination is the most important strategy to end the pandemic, there also are many other important interventions that can decrease the spread of disease in our community and in our schools. The Virginia Department of Health identified 9 key prevention strategies, which when layered together are very effective in reducing the risk of disease. And by layered strategies, what we mean is that no individual strategy in and of itself will be perfect, but that by combining the strategies, one can most effectively reduce the spread of disease. Certainly, with COVID in our community, there will be cases that are introduced into our schools and introduced into the SAC program. But the purpose of these mitigation strategies is to prevent transmission from occurring. And in that context, they can be very, very effective. So let me go through just a couple of these. I've already talked about vaccination, and on the next slide, I'm going to talk about masking. And I do want to point out that while we focus and we talk most about masking indoors, In the SAC program, masks are also going to be recommended for use outdoors, where kids may be playing close together, and particularly while the transmission of disease in our community is at the substantial or the high level. In terms of physical distancing, the recommendation for classrooms between children is 3 to 6 feet, but among adults and children, or adult to adult, 6 feet are still recommended. So please pay attention to that physical distancing, particularly among adult contacts. Where in school settings, there will be times when the 3 feet distancing cannot be maintained because it's so important to get everybody back into the school setting. And again, when we have layered strategies, hopefully the strong implementation of these other layers will make up for the additional risk for not maintaining those distances. Screening is going to be done before the SAC program when students arrive in the mornings, and also will be done by FCPS with parents screening their children before they send them to school in the morning. In terms of healthy facilities, that's number 7. There are cleaning protocols before and after children are present in the SAC room, as well as before and after snack. And because CDC has shown that disease is much less likely to be transmitted by objects than it is by respiratory droplets, kids will be allowed to share items, again, as the primary mode of transmission is respiratory. In terms of isolation, kids who are symptomatic will be separated in a care room before being sent home, and then the health department will investigate any positive cases with contact tracing, isolation, and quarantine. Not shown here among these 9 prevention strategies is a 10th strategy that you'll be implementing in SAC, which is to cohort children and staff, which adds another protective layer by reducing the number of children that are in contact with each other. So while multiple layers do increase effectiveness of prevention, I really want to highlight the importance of one measure, and that's masking. While in some parts of our country, masking is politically controversial, the science supporting it is very clear. A recent publication in one of the American Medical Association journals presents the evidence and states that compelling data now demonstrate that community mask wearing is an effective non-pharmacologic intervention to reduce the spread of this infection, especially as source control to prevent spread from infected persons, but also as protection to reduce wearers' exposure to infection. And I would like to take just a few minutes to go through each one of these underlined phrases. First, what are the compelling data? The authors of this article present 11 studies done in multiple countries and using different study methods, all of which show the effectiveness of masking. For example, there's a study from a US aircraft carrier where people live in tight quarters, where masking was linked with a 70% decrease in disease. There's also a study from Kansas, where in counties with a mask mandate, rates of disease went down, whereas in counties without a mask mandate, it went up, and so on. Second, I want to highlight the term source control. And what this means is that masks trap the secretions of people who are wearing them and help protect other people from contacting those secretions. Thus, part of why we wear masks is to protect others, and that's why it's so important that everybody does this together. And then finally, reducing wearers' exposure refers to the protection that masks afford to the person who is wearing them. And to maximize this protection, it's important to use a multiply mask, which fits well and doesn't gap around the nose and around the cheeks, so that there's less air that may come in around the sides of the mask. I want to spend a little bit of time going through the Virginia Department of Health algorithm for evaluating a child with COVID-19 symptoms or exposure. And this algorithm has a section for parents and guardians, for schools and child care facilities, for healthcare providers, and then a section on return to school. And this is updated from what existed last school year. At the top of the algorithm is guidance for parents or guardians. And the key guidance here is that parents who have a sick child who has symptoms that are new or unusual for them should keep that child home, and they should contact their healthcare provider to be evaluated. Children who have usual symptoms, which may be allergies, migraines, asthma, can either seek care if needed as usual, or if they are afebrile and can go to school, they can then get sent to school or to child care. The second section is guidance for schools. And this guidance focuses on if a child develops symptoms that are new for them, isolating that child from others in the care room, and sending them home for clinical evaluation. The third section of the guidance is for healthcare providers. And the emphasis here for healthcare providers is on testing children who have new symptoms or symptoms that cannot be explained by their usual medical conditions. In this context, doing either a PCR test or an antigen test is acceptable. And then finally, the guidance on return to school is different from the earlier guidance in that if a child has no clinical evaluation, the recommendation from VDH is that that child stay home for a 10-day period of isolation if they are symptomatic, and after that 10 days can return if they are afebrile without fever-reducing medication. And if they are asymptomatic but a close contact and have no clinical evaluation, obviously because of that contact, they would need to complete a 14-day quarantine. So that's all I want to present today. I'm certainly happy to answer any questions that you have. And again, I want to thank you for all of the work that you do.
Thank you so much, Dr. Brown. We appreciate your presentation. It sounds like I have an echo. I'm not sure if that's coming across to everybody else or not. But we also appreciate the opportunity to ask and have you answer some of the questions that have come up. I'm going to take a second and just pull those up. I know that one question that you had kind of already addressed in terms of when staff who might be immunocompromised to be eligible for the booster vaccine. And kind of related to that, we have a question about if somebody has been fully vaccinated, will there come a time for a semi-annual booster shot of the vaccine as we move to and through the flu season?
Yeah, we don't know when a booster shot may be recommended. CDC has not made that recommendation yet. Studies are ongoing to look at the duration of protection, how long the vaccine that we've already received is protective. And then based on the results of those studies and on information about variants, a booster may be recommended in the future. But right now, I think we can just feel confident that the vaccinations that we've received are still providing protection against COVID and against the Delta variant.
Thank you. There is a question about the Delta variant and symptoms. Are they the same as regular COVID symptoms, or are there symptoms that are more common with the Delta variant than the original COVID that we saw back in March?
I think they're not substantially different. I saw something earlier today suggesting that maybe headaches and sore throat may be a little bit more common. But, the number of symptoms or the types of symptoms that one may have with COVID infection is pretty broad. And it may include respiratory symptoms, fever, flu-like symptoms, muscle aches. It may include GI symptoms, diarrhea or vomiting. So really, with the COVID, with the Delta variant of COVID or other viruses, any of those symptoms could certainly occur.
Thank you. We appreciate that information. Some of these might also have a programmatic, angle to them as well. So between the two of us and Anne, if you're able to answer some of these. One of the questions is, what is the best or safest way for our substitute teachers to work at multiple centers?
I think the part of the answer I'd like to give, and maybe Rhonda, you and Ann can expand, is that substitute teachers who are going to be going to multiple classrooms can best protect themselves and others by getting vaccinated. I think it's certainly important for anyone who's caring for children to receive the vaccine, but I would also want to emphasize that for substitutes. And certainly if there are any questions or any concerns about the safety of the vaccine, those could be addressed if you call our call center at 703-324-7404. Or if you wanted to contact me, I would certainly provide the information so that people can make a good choice about getting vaccinated.
Thank you, Dr. Ben. The only thing that I would add about the vaccination for subs is that we would want anyone who's working in a SAC center to have training in the health and safety protocols and all other required trainings, and to implement fully all of the health and safety protocols, which the layered approach that you described and are found in our health and safety planning document. This distancing, wearing masks, hand washing, all of those are mitigating strategies as well, though we know that the vaccine is at this time the most reliable way of ending the pandemic.
Thank you both. The next question, and there's a couple that have come in about this. It was kind of addressed during the presentation. Is it safe for children to be using shared equipment, whether that might be furniture, tables, couches, supplies like markers, pencils, books, board games?
It is at least relatively safe to do so. As I mentioned, the primary mode of spread is respiratory. Shared objects have not been shown to be a significant source of transmission. And so while, in very, very young children who put things in their mouth, there may be more risk. In the age of children that you serve in the SAC program, it's probably not a substantial risk.
Thank you. There's also a question, and again, this might be more of a programmatic. Can the children safely play sports in the childcare setting, like basketball, like football, kickball, games where children might share a ball?
Yeah, and I'm glad you asked this question, because it also allows me to go back to the last question and to say that getting COVID on your hands in and of itself poses no risk. It's really when you put your hands in your mouth or touch your nose or your eyes, that there may be some level of risk. And so the other part of shared objects and shared sports and sporting objects is certainly washing your hands, right? So after you're outside, after you come in from playing, wash your hands, and then that will further mitigate the risk. So again, it's those layered approaches and understanding how the COVID virus is spread and how we can prevent its spread becomes really important.
Thank you, Dr. Ben. One thing that we had also talked about with our health and safety work group is adapting some of the games that might require or more typically involve close contact. So if it's a basketball game or a flag football game, our staff are great at adapting, those games in order to support the physical distancing. And as we've said, we will continue to have children and staff wear masks both outside and in the gym as well. Let's see, another question that has come up is about storing personal items, whether that might be backpacks. What is the safest way for children to store their personal items from home?
So let me turn that over to the program to answer.
Sure. I think what we were recommending is that, other than backpacks, that children not be bringing toys from home, and any personal items that they have, that they not be shared. And after they use whatever they have brought, that they wash their hands before they have interactions with other children or staff.
Thank
So
you,
personal
Anne.
items should be kept separate.
Thank you, Anne.
Sure.
There was another question also about elementary age children and when it was anticipated that they might get vaccinated. I believe that you said that we are hoping or anticipating that the FDA might approve that vaccine in October. Is that correct?
That is correct, but the timeline depends on the data that's submitted to the FDA and how long it takes to evaluate those data. So originally we were hoping September. Now I've heard it may take a little bit longer, but we'll need to see.
Thank you. There's also a question about parents being allowed into the SAC centers this school year, whether that's at drop off or at dismissal when they're picking up their children. Anne, would you like to talk about that a little bit?
Yeah, so that question is because the health department has, not the health department, state licensing has indicated that we cannot exclude parents from entering the center when their children are in care. But we can say that they can stay. Welcome to wait by the door. So we can say that where they can go in the facility, they don't have to but the door is at a room, which is where the children are. So I think that we'll have to communicate with families the importance and why it is that we want to make sure that there's physical distancing between all adults, just as when they arrive in the morning with their child, whether they remain in their car or whether they're walking their child to the door, we ask that they remain 6 feet distance from other adults and children. And so we would have to continue to have those standards in place. And again, in our communication with families in advance of school starting, will be to explain why it is that the protocol has been that visitors are to be excluded, even though as a parent with a child in the program, we're happy to speak with them as long as we're able to maintain the health and safety standards at the door. Does that sound reasonable, Dr. Ben?
Yeah, it does. So what I think you're saying is that they can come into the facility because that is kind of mandated, but that you don't want them to go into the room, into the bubble itself. And I think that makes a lot of sense.
And we can follow up with the schools. I know that, I mean, typically parents don't go into the classrooms in the schools.
Thank you both for that answer. I know as the schools are making their preparations, different schools are, you know, kind of have the different layers of mitigation that they're doing. You know, I can speak for, you know, my child's school and saying that if there is a, if you're picking up your child early, it's the ringing of the bell, that families are not, you know, going into the school offices they necessarily, you know, would have before. So it's very similar in what, you know, we're doing. And again, that might vary, you know, from school to school based on, you know, the layout. So again, just to reiterate that it sounds like what we're doing is in line with, you know, what the schools have in their preparation and planning. There is a question also about the wellness room, and will SAC have a wellness room for this school year? How will that work, or what would that look like?
Yes, well, we absolutely will have to have a wellness room. It's a requirement. And right now we're working with the schools around the use of wellness, the care room that will be available in each room. So that's been communicated with to FCPS and FCPS leadership. And that's what we're working on together with FCPS.
Thank you, Anne. Dr. Ben, you may have discussed part of this when you were going through the VDH information. Will children who are symptomatic be required to furnish a doctor's note to verify return to school with or without a quarantine period? And again, that's for children who are symptomatic.
I would need to talk with our containment team on that. I don't know what whether FCPS is requiring a doctor's note for them to return, and you would be able to say whether at SAC you would have that requirement.
At this time, we are asking for documentation from a healthcare provider for children or staff to return following absence due to experiencing symptoms. Testing, we want to know the results of the test before they can return, or if they had been identified as a close contact of someone who was confirmed or diagnosed positive for COVID-19.
Thank you, Anne.
Sure.
What makes the Delta variant so much more contagious than the previous versions of COVID-19? Should parents of kids under 12 be worried about kids returning back to school at full capacity?
The Delta variant is more transmissible because the virus seems to bind the receptors in our respiratory tract better and grows to higher levels. And so there's more virus in those who are sick, and therefore when they have respiratory secretions, when they cough, sneeze, talk, sing, more viral particles are spread into the environment. It does increase the risk, but we strongly feel that with the protective measures, with the layered strategies, particularly with masking for source control, as well as to protect the people who are wearing well-fitting multiply masks, that the risk will be small and that we can minimize the transmission that occurs. I certainly would not say that there will be no outbreaks, but I think that we can really minimize any outbreaks or any disease from spreading if we adhere to those mitigation strategies, those layered strategies.
Thank you, Dr. Ben. We appreciate the emphasis on the mitigation strategies that are in place. There's the question about recommendation for siblings or children that are in the same school classroom. Is it recommended that they be in the same cohort or bubble within SAC?
Let me just, just say a word about cohorting, and then Anne can talk about what's being done in the program. So cohorting is a good strategy because it reduces the number of people a child comes in contact with who could potentially be infectious. And so it may make sense to keep children together who are in the same family or who are in the same school classroom, but I would think that inevitably the SAC cohorts will not exactly reflect the classroom cohorts, so that there'll be a little bit of an increase when you compare with, who they're cohorted with in FCPS and who they're cohorted with in SAC. But it still will be better than if the cohorting in pods did not exist at all.
Thanks, Dr. Ben. I agree with that even though on one level we know that the children, if there's a sibling in 4th grade and a sibling in 2nd grade, that during the day they're in different rooms and different cohorts. But when they come to SAC, we are going to want to have them together. And then if there can be a group that has other children from the classroom, to keep them together. I think that we know, as you said, that the cohort bubbles engagement are changing and forming throughout the day for children. They're at home, they're on the bus, they're in a classroom, they're in SAC. When they go home, maybe they're going to, someone's home or to the store. So we know that that's what reality is for families, but what we're trying to do, as you said, in the SAC program, is to do the best that we can through developing of our bubbles and keep children together to the best of our ability.
Thank you both. I appreciate the joint response and insights from both perspectives. There is a question about parents. Will they be required to wear masks? I don't know, Anne, if you want to go ahead and take, that one just.
Yes.
That's easy.
Yes. Parents, any adult, I think it's a requirement on school grounds and that everybody, you get out of your car, please put your mask on. Everyone needs to wear a mask.
Thank you. Let's see, a couple more questions just came in, so I'm going to try to go through them. If vaccinated experience no symptoms and have COVID, you are least likely to be tested. So is there a bigger risk for children who are unvaccinated, especially during times when eating, when the mask is down?
So if I'm understanding the question correctly, and correct me if I'm wrong, it's about people who are vaccinated who become asymptomatically infected and then may transmit the infection to someone else. And so let me try and parse that out a little bit. So first of all, vaccination is largely protective against infection. The studies that have been done have shown a range between 64 and 88% effective, and the median is 81%. So over 80% of infections are going to be prevented by vaccination. Now, what that means is that some people who are vaccinated still are going to become infected, and they can spread the infection to others. They will be masked in the room. They're going to be, following the other mitigation guidance. But the questioner was asking specifically about snack time. And so I think it is important that during snack time that in your SAC rooms, you do try and physically distance people. I don't know if there is an option for having snack outside. Certainly maybe having snack in 10 minutes rather than, spreading it out into 15 to 30 minutes, minimizes the amount of exposure with people's masks off. But I do think that, again, with the vaccination, with the other mitigation measures, with the physical distancing while children's masks are off, that we can do a very good job in limiting any risk that occurs.
Thank you.
Thank you, Dr. Ben. I do believe you answered that question, so I appreciate that. We do have a question about, I guess hopefully is not the case, but in the event that COVID numbers rise, what is the, I guess what do the schools look at in terms of, their operating procedures? What is the plan if we continue to see the increase?
The plan is, as I understand it, is that kids are going to be in school. It is so important for kids to have that in-person learning, both for all children, but particularly for children who may have some additional needs in school and for whom the distance learning is not as effective. So even if the cases in our community go up, my understanding is that school would continue. And so again, it really points out the importance of not just the level of community transmission, but the importance of the mitigation measures that can be applied at school. And so it sounds a little bit like a broken record, but again, it's the masking, it's the screening, it's making sure that people who are sick don't come to school, et cetera, that's going to help keep our kids safe, even if the level of disease in the community does go up beyond where we are right now.
Thank you, Dr. Ben. We do appreciate that response. This this is more of a programmatic question, and I'll have this be our last question as we get close to 3 o'clock. The question is about doing the daily health screening. Are we supposed to ask the category of symptoms or the individual symptom?
So we have put them into those categories. So category 1, fever and chills, category 2, respiratory or flu-like symptoms. But then there's the list. So in asking the question, we're saying them, but we're only asking parents to say yes or no to the 3 groups. And then the 4th part being the one on testing and exposure. And I know, so we've been using that grouping throughout Camp Fairfax, so not everyone has been using that screening method. So we'd be happy to talk more about it. And tomorrow afternoon, there will be cluster meetings, and I think best practices on how the screening is going will be really important to share.
Thank you so much, Anne. I want to thank both of you for taking the time to answer questions from our staff as they've come up, both specifically related to COVID-19 and the Delta variant and the mitigation strategies, as well as some of the programmatic aspects of our HSP and the procedures that we'll be implementing this school year. So again, thank you both for your time, and Dr. Ben, as always, for sharing your expertise and guidance. We've appreciated this ongoing partnership with you and your colleagues at the health department. And again, just want to say thank you for all of your support and guidance over the last year and a half.
And thanks, Rhonda, and thank you for setting up the call and for joining us as well, Dr. Ben. I just want to mention that the OFC vaccine survey is out. So if you don't see it in your inbox, please check your junk mail. Thank you very much. And I think that's all I have for now, but have a great week. Welcome back. Welcome back to SAC. We're very, very excited to be able to serve children before and after school in all the locations across the county. Dr. Ben, thank you. Have a great rest of the week. See you at orientation.
Thank you, everyone. Have a great day.